let's move on to compliance. What is compliance? See, compliance is basically the ability of the lung to stretch, and compliance is always inversely proportional to elastance. So first let's understand what is compliance and what is elastance. So look at this balloon. I'm going to blow into this balloon. So the balloon stretches. So this shows that the balloon is compliant. So compliance means the ability of the balloon to stretch or ability of the lung to stretch. Now I'm going to release this. See, it is coming back to its original position. It is recoiling back. So this recoiling is called as elastance. So you find that compliance is inversely proportional to elastance. Ability to stretch is compliance. Ability to recoil back is elastance. And the formula for compliance is change in volume per change in pressure, delta V by delta P. So look at this compliance graph. So it will correlate pressure on x-axis and volume on y-axis, and you have a normal curve and a curve with increased compliance and a curve with decreased compliance. So probably in the next pattern of exams, you can have questions like this. They can give you the curve and they can ask you to identify the name of the disease. So let's analyze this curve. So look at the normal curve. Let's take a constant pressure of 10 centimeter of water. So for this change in pressure, see what is the change in volume. In a normal curve, it is around 5 liters. But now look at the top curve. For the same 10 centimeter of water pressure change, look at the volume change. It is around 7.5 liters. See, it means that in emphysema, compliance has increased. Normally, you can take in 5 liters at 10 centimeter of water pressure, but in emphysematous condition, it increases to 7.5 liters. Why? What happens in emphysema? See, emphysema is a disease where all the individual alveolar walls, the septa, are damaged. So the alveoli, all the walls are damaged. It becomes one big bag which can expand very well. So it becomes like this. Therefore, it can stretch very well and compliance increases. So let's take this pink balloon which indicates normal compliance. So I'm going to apply the same pressure for all three conditions. See the change in volume. So this is normal compliance. So let's take this orange balloon which indicates emphysematous lung. Now look at the change in volume. I'm going to apply the same pressure, same 10 centimeter of water. Look at the change in volume. It is more. So what does this tell you? This orange balloon is able to expand more. It is able to stretch more. So its compliance is more. So in emphysema, compliance increases. So now let's look at fibrosis. See, what is fibrosis? It's an obstructive disease or restrictive disease? Yes, fibrosis is a restrictive disease. It's something like a fibrotic scar tissue around the lungs. So the lung is not able to expand. There is restriction. So it's not able to expand properly. So now what happens? Look at the curve. For the same 10 centimeter of water pressure in a fibrotic lung, the change in volume is only around 2 liters, which means that this lung is not able to stretch because there is a fibrotic scar tissue which is restricting the lung from stretching. So that is why compliance decreases in fibrosis. So look at this blue color balloon. This is a fibrosed lung. See, it is not able to stretch at all. There is no change in volume at all. It's very less. So this pink one indicates a normal lung. The orange indicates increased compliance in emphysema. The blue one indicates a fibrotic lung where compliance is very less. It's not at all stretched. So this explains the concept of compliance. And you can be asked various conditions where compliance is more and compliance is less. So few other conditions where compliance can be increased apart from emphysema in old age or a flail chest, or if the person has undergone any sternotomy. So in all these conditions, compliance can increase. Apart from fibrosis, what are the conditions where compliance can decrease? Any other restriction like pulmonary edema or a pneumothorax or any consolidation, scoliosis. Scoliosis is abnormality of the spinal cord. So in all these conditions, fibrosis, pulmonary edema, etc., compliance can decrease. So you should be able to analyze the curve. That is more important in your next pattern of exams. Next, let's move on to surfactant. See, compliance is mainly determined by a factor called surfactant. So what is this surfactant? Surfactant is produced by which type of cells? Can you remember? Type 1 or type 2 pneumocytes? Yes, it is your type 2 pneumocytes. Surfactant is produced by type 2 pneumocytes. And this surfactant is made up of lipids, which constitutes around 90 percentage, and proteins, which constitutes around 10 percentage. And what are the important lipids that are present? Lecithin. Lecithin is otherwise called dipalmitoyl phosphatidylcholine DPPC, and sphingomyelin. What are the important proteins? Surfactant proteins type A, B, C, and D. So, what are the functions of these lipids and proteins? See, the lipids, especially lecithin and sphingomyelin, they are responsible for decreasing the surface tension. So, this is the most important function of surfactant. Surfactant reduces the surface tension. We'll see what is that. Proteins, their main role is in defense mechanisms, immunity. They play a role in immunity. So, let's learn about surface tension now. See, we already discussed surface tension in renal physiology in our cystometrogram. So, what is the law related to surface tension? Yes, it is your Laplace law. So, what is Laplace law? According to Laplace law, P is equal to 2T by R. Pressure is equal to 2 times the surface tension divided by radius. So, how will you apply surface tension here? So this P indicates collapsing pressure of the alveoli. T indicates surface tension, and R indicates radius of the alveoli. So let's take a newborn baby. Okay, a newborn baby is going to breathe now. So when the baby is breathing, during inspiration, what happens? See what happens during inspiration. Inspiration is taking, imagine this is the lung. Baby is taking in air. So the radius increases. And can you see that the balloon has become more shining now? The shining nature indicates that it has become more tense, which means surface tension has increased. So during inspiration, radius increases, surface tension also increases. See what happens during expiration. Radius decreases, surface tension also decreases. So during expiration, radius decreases, surface tension also decreases. See, this decrease in surface tension is brought about by your surfactant. Surfactant only has decreased this surface tension. If suppose the baby is born without surfactant, a deficiency of surfactant, this decrease in surface tension cannot happen in the baby. See, as a result, let's see what will happen. So, if the baby is normal, if surfactant is present during expiration, radius decreases, surface tension decreases. Since denominator and numerator both are decreasing, what will happen to the collapsing pressure? It will remain constant. That is why the alveoli does not collapse. It's because the collapsing pressure is not changing. But if suppose the baby is born without surfactant, now during expiration what will happen? Radius will decrease, no surfactant. So surface tension cannot decrease. So this cannot decrease. So denominator is decreasing, numerator is not decreasing. So what will happen to collapsing pressure? It will slowly begin to rise. When collapsing pressure rises, the alveoli collapses. When all the alveoli collapse, it results in infant respiratory distress syndrome or hyaline membrane disease. So this is a disease where there is deficiency of surfactant, and when the baby is taking the first breath, all alveoli go for collapse. Now how can you treat this baby? So pediatricians, what they do, When you identify this respiratory distress syndrome, there is no surfactant, quickly give surfactant replacement therapies. So the drugs that can be used are lusinactant, beractant, and Servanta. So these are all some drugs which are used for surfactant replacement therapy. So they are drugs which act like surfactants. You identify that there is no surfactant, so treat the baby with surfactant. Now, this disease is identified once a baby is born. But if the physician who has handled this case previously, antenatal period itself, she could have identified this disorder between 28 to 32 weeks of gestation. Gestation means when the baby is inside the mother's uterus itself. Why especially 28 to 32 weeks? Because this is the period during which surfactant is produced. So during this period itself, what the physician could have done, so if she is suspecting that the baby will be born without surfactant, you can take a sample of the amniotic fluid and do the following tests. You can do an LS ratio. LS ratio is lecithin to sphingomyelin ratio. If LS ratio is more than or equal to 1, it indicates that surfactant is present because there is more lecithin, which is more contributing to the surfactant property. So if LS ratio is more than or equal to 2, it means surfactant is present. Or she could have done Clement test, otherwise called shake test or bubble test. So here in a test tube, a sample of amniotic fluid is taken and you just shake it. So when you shake that, if you see bubbles, it indicates that lecithin is present. Lecithin is a lipid, so they will produce bubbles. So the presence of bubbles indicates that surfactant is present. If there are no bubbles, it will indicate that surfactant is deficient. Or you can do a lamellar body count. Lamellar body count. What is this lamellar body? They are small bodies where surfactant is stored like this. So if lamellar body count is more than 30,000 per microliter of the amniotic fluid sample, it indicates that surfactant is present. If it is less than 30,000, it indicates that the baby has surfactant deficiency. So during 28 to 32 weeks, when the baby is inside the mother's womb itself, the physician could have identified the disease. If suppose she has identified that surfactant production is affected in the baby, now what can she do to treat this baby? So now you can give steroids to the mother, especially steroids like betamethasone. What is the use of giving steroids to the mother? So if you treat the mother with steroids, steroids have the ability to increase the surfactant production. So by the time the baby is born, this steroid would have increased the surfactant production in the baby. So when baby is born, it will not have respiratory distress syndrome. So this is how you will diagnose this when the baby is in utero itself and treat efficiently.